You're watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. I'm Kenneth Igbomor, and thank you so much for joining me on the show. Today, our focus is on Sierra Leone, and we'll find out how the West African country is leaning on the experience of the Ebola outbreak to tackle the COVID-19 pandemic. You can join the discussion and let us know your thoughts on social media. The hashtag to use is Beyond Markets. You can also hit me up on my handle, that's at Kenneth Igbomor. Now, the IMF says COVID-19 pandemic is taking a heavy toll on Sierra Leone, and it puts the hard-won gains since the Ebola outbreak in jeopardy. But with just under 2,000 confirmed COVID-19 cases, the West African country is using digital payments infrastructure set up during the Ebola outbreak to keep its economy going. Dr. Patricia Laverley, she's the Deputy Finance Minister of Sierra Leone, and she joins me now to discuss the country's response so far. Thank you so much for your time on the show, man. Let's first start off by getting your assessment of the pandemic on the global front.
For us in Sierra Leone, given our experience with Ebola in 2015, we have significantly benefited from that experience in the sense that when the Ebola pandemic happened in 2013, it was a shock to not just us in Sierra Leone, but to the world. And that enabled us to better manage the corona pandemic vis-a-vis our peers who had not experienced a pandemic of this magnitude. In 2013, the country established an Ebola operations center out of the Ministry of Defense. Now, that center was operational for about 3 years, 2014, 2015, and about 2016. So when the COVID pandemic emerged, because of the experience that we had during the Ebola crisis, it was easier for us to establish institutional structures to have arrangements in place to deal with the pandemic in Sierra Leone.
All right, now let's talk about the outbreak and how you've gone about handling it so far. I understand that just before you had your index case, you developed a COVID-19 preparedness plan 3 weeks before this first case came in. I'd like to know how that has been so far.
Well, indeed, we had an index case in March of this year, and what the guiding framework in dealing with the crisis is twofold. We have two strategic documents that we're using to manage the COVID response in Sierra Leone. The first is the emergency health response, and that to a large extent is managed by the Ministry of Health and Sanitation. And for us in the Ministry of Finance, the ministry developed an economic response program that's intended to respond to the macro and micro level effects of the pandemic. And those, I'm pleased to say, are in place. They've been adequately resourced and they're being effectively implemented. So vis-a-vis our peers, with our experience with Ebola, we're managing the COVID situation in a relatively seamless manner.
All right, but how much is this going to affect your economic growth targets so far for this year?
Okay. Well, with respect to growth, of course, like all other countries, we're also experiencing a downward revision to our growth figures. It was estimated before the pandemic, it was estimated at about 5%. And now the projection is about 2 to 3 percentage points downward. So, but we have a good economic response in place with the help of our partners, and even for us in government, we've put mechanisms in place to deal with the pandemic. Unlike the Ebola period, where there weren't any lessons, it was a shock to the system. This time around, we're better prepared to deal with the contact tracing, the surveillance, prevention, and treatment. Our healthcare workers were trained during Ebola in addressing medical emergencies. So that has helped us remarkably in dealing with the COVID pandemic.
All right, but let's get into that level of fiscal response that we've seen so far from Sierra Leone and how you're helping to mitigate the impact, especially on the life and livelihoods of your citizens.
Sure. Just last month, we actually developed a supplementary budget on saving lives and livelihood. And the supplementary budget was passed in Parliament last month. And in that budget, we basically try to respond to the additional fiscal pressure that emerged as a result of the COVID-19 in responding to both the health issues, strengthening medical facilities, increasing ambulance services, strengthening medical facilities at the border and in the most rural parts of the country. With respect to the economy, we've come up with solutions to address our monetary policy issues, our fiscal issues with respect to ensuring that short and immediate expenditures are met, and so on. So we're in a fairly good position. The response, the support that we've received from our development partners has been very encouraging. On the downside, given the slowing down of economic activity, of course, it's affecting domestic revenue mobilization efforts, and we've struggled a bit with internal revenue generation in Sierra Leone, but the response from our partners has been very encouraging.
All right, well, now let's get back to the lessons that we're learning from Ebola and how you're putting things together. And I'd like to know in specific terms, though, how the government has leveraged on the infrastructure built during that Ebola crisis and how you're deploying that in to come up with COVID-19 solutions.
Sure. As I mentioned to you, during Ebola, we had an emergency operations center that was established, that was managed by the former Minister of Defense. This time, yes, we do have a national COVID emergency response center that is housed within the Ministry of Defense, but working very closely with the Ministry of Health and Sanitation. Now, the institutional arrangement that we have in managing the COVID is not just limited to national level structures. There's also district level coordination. There are district level emergency response centers that are intended to respond to COVID-19 at the sub-regional level. And we have 4 such centers across the country. And it's through these centers that we are following up on contact tracings, the surveillance that's needed, providing treatment, providing treatment services, and so on. Now, this sub-national structure has proved to be very effective in that we're closer to the victims that are affected by the pandemic.
All right, I remember during the Ebola pandemic covering a story around digital payments and how Sierra Leone is using that to, help the efforts in combating the Ebola crisis at the time. But I'd like to know, let's look at the benefits from that Sierra Leone's inclusion into that United Nations-backed Better Than Cash Alliance. And I'd like to understand definitely how that can quantify the benefits of making that switch to digital payments and how that is playing out to help the efforts in fighting COVID-19.
Indeed, Sierra Leone became a member of the UN Capital Development Fund's Better Than Cash Alliance in 2015. Now, at the time, we were setting up, in 2015, the Ministry of Finance was then trying to register the Ebola healthcare workers in its mobile, in ensuring in 2019, I'm going to repeat what I just said. In 2015, what we tried to do as a country was to make the shift from manual cash payments of salaries to healthcare workers to ensuring that the Ebola health workers had mobile payments. That was 5 years ago. Now in 2020, most healthcare workers that are involved in providing services to COVID victims do have mobile accounts, and the salaries, allowances are all being paid through the mobile accounts. So indeed, the Better Than Cash Alliance that was established here in Sierra Leone in 2015 has proved to be very helpful in the sense that we've improved the efficiency of our payment processes to our healthcare workers in Sierra Leone remarkably. So we're very pleased to be part of the Better Than Cash Alliance, and we're now working on expanding our digital payment system across the country. It includes allowances, delivery, payment for medical services to victims, and so on. So because of the legislative progress that we made last year in improving the digitization of our economy, we now have more businesses and individuals with mobile accounts. And for us in the Ministry of Finance, we're now working intensely, relentlessly on ensuring that many Sierra Leoneans do have digital accounts that we can channel payments so that we can improve and modernize the efficiency. We can modernize our financial services in the country.
All right, but when you look at the amount of cases that is in Sierra Leone currently, just under 2,000, and I'd like to know of this percentage, how many of that are healthcare workers, and how much do you think this initiative is what is helping to reduce those numbers?
Well, in the sense that because more Sierra Leoneans do have mobile phones and do have access to mobile payments, the cash is circulating around the country easier. And with availability of cash, the average Sierra Leonean has access to basic information on how to prevent them from contacting the disease. The National COVID Emergency Response Center has a social mobilization pillar, and that pillar is using SMS, all forms of a lot of different digital channels to promote messages about the prevention of COVID-19. So on the one side, just the basic access to mobile phones through some of the cash that we're providing to communities that do have experienced the disease is proving to be beneficial, because as more Sierra Leoneans obtain mobile phones, more Sierra Leoneans have access to basic information about the disease, about the disease, and can actually pay for the disease with the mobile payments. Now, one thing we've also done through the economic response is the cash transfer payment that we've set up. What we're trying to do with a national a National Commission for Social Action is to provide direct cash to as many vulnerable Sierra Leoneans as possible. And through this initiative, we've increased the distribution, of cash to vulnerable groups, and putting them in a much better position than they otherwise would be had the cash not been available to them. And all these payments are being processed using mobile money systems.
There's no doubt that the COVID-19 pandemic played a double whammy on both the health and the economic systems across the world. But I'd like to know, for the case of Sierra Leone, I'd like you to speak to the importance of not losing the progress that that your country made so far since the Ebola outbreak, first on the healthcare systems and also on the economy.
It's leadership. What His Excellency the President, Julius Maada Bio, did, even before we had our index case, was he led the advocacy and social awareness and mobilization effort. He went throughout the country. He issued recorded messages informing all Sierra Leoneans about the COVID-19 situation. And this was powerful. When you have the executive, the commander-in-chief, advocating to all its citizens that this is what is happening in the world. You must prepare for it. We have lessons to learn at an individual level. Let's protect ourselves. Let's limit contact. We need, practice the isolation, listen to the messages coming from the Ministry of Health. This, COVID-19 is different from Ebola. We must prepare for it. Let's not forget what we just went through. We don't want history to repeat itself. And President Madabio really helped significantly to ensure that all citizens in Sierra Leone know about the dangers of the disease, are taking concrete steps to protect themselves and prepare themselves against the disease. So and also his sensitization was not just about the medical side, but also the financial side. He also advised citizens to manage their finances better because of the slowing down of economic activity that would result because of COVID-19 across the globe. So we're very prepared in Sierra Leone because of the leadership that we had. He took the lead in sensitizing all Sierra Leoneans to prepare for it. And I'm not sure, how many countries, I'm not sure of how many countries had their leaders leading the sensitization and advocacy, to, prepare for the disease and how they should respond to the disease. So we're grateful for the leadership that we have in Sierra Leone.
All right, but still in dealing with the socioeconomic impact of this pandemic, I'd like to know the level of feedback you are getting back, first from the average citizens of Sierra Leone and also the private sector.
Oh, the average citizen, well, when it comes to Sierra Leone, we've now instituted fines in the country for citizens that do not wear masks. And the fines are fairly steep. Okay, no one wants to pay a fine because of their carelessness. So usage of masks it has been embraced by all Sierra Leoneans, and they're taking that aspect of the disease very seriously. With respect to the economy, as I mentioned, we do have a quick action economic response program. And that program is costed at about $150 million. And, for us as a government, we've put aside a certain proportion of our reserves, our internal resources, to support businesses who, with their recurrent expenditures, to minimize the effect of COVID-19 to the businesses. Now, some of these resources provided by Bank of Sierra Leone, there's a Bank of Sierra Leone facility where we're issuing loans to commercial banks for onward lending to small and medium entrepreneurs. And this facility is working well, where the rules and governing arrangement that have been put in place to manage the funds channeled through this facility are prudent. We expect I think the loans that would be issued through the commercial banks would be managed well because of the rules and procedures that have been put in place to manage the fund. It's small, it's only about $50 million. And the focus is on, we've identified the sectors that would most benefit from the facility. And the facility, I'm pleased to say, is being managed extremely well.
All right, but still on the private sector, though, I would like to know how they've stepped up to the plate to assist the efforts of the government in helping to deal with the pandemic.
As I mentioned, we're providing tax relief to our importers and manufacturers of our locally consumed goods. We're providing support to them for the importation of essential commodities. As I mentioned, the Bank of Sierra Leone has a special facility that has been put in place in the tune of about $50 million that has been offered to our commercial banks in Sierra Leone to help our small and medium businesses with their production, importation, and distribution of basic goods and commodities in the countries. That way there's no disruption. in their business activity. Let's talk about credit schemes, for example. We are now putting together a national microcredit scheme, again, to support our small and medium enterprises, providing loans to small and medium enterprises. That way, there's no disruption in their business activity. On the consumer side, as I mentioned, we have a safety net program in place where we're helping the most vulnerable with, small amounts of money. That way, they can at least afford their basic goods, they can pay their rent and so on. Given either if they've either been unemployed or their small businesses are not functioning and so on. At least the small cash, the small amounts of cash that are being distributed to vulnerable groups would be used to ensure that their basic needs are addressed during this period.
All right, but I can imagine the stress of all of this on your country's budget, and I would like to talk about the kind of funding support your Sierra Leone has received from international partners. In June, I know your country received about $143 million from the IMF, as well as funds from the AFDB as well. I'd like you to talk about these interventions and how they're helping you to close these financing gaps.
We've got a budget of, it's a small national budget, but the supplementary budget that we took to Sierra Leone is indeed intended to address the fiscal pressure that emerged as a result of the pandemic. The support, I'll just quickly give you a rundown of the budget support that we've received from our development partners. And yes, you rightly mentioned, we received about $143 million from the International Monetary Fund through the Rapid Credit Facility. And those funds were channeled directly to the Consolidated Fund. And those funds are, to a large extent, used to address the economic response that some of the activities I just described to you. For example, I've talked about the safety net. I've talked about the loan facility through the Bank of Sierra Leone. I've talked about the national scheme. So because budget support comes directly to the Consolidated Fund, what we have been doing through the economic management team is sit down and prioritize the short and immediate fiscal needs coming in from our partners to directly respond to the COVID emergency that we're dealing with. The World Bank, in addition to the International Monetary Fund, also supported us with $100 million. So between these two institutions, we've managed to mobilize about $250 million. However, the support that we received from the World Bank was budget support that should have actually dispersed in 2019. So because it arrived this year, it's actually helped us quite significantly because it's coming at the right time, in the sense that our revenue targets, we're experiencing difficulty with meeting our revenue projection, and the budget support from the World Bank has come in at a very critical time when we're not meeting our revenue target. The other regional development banks have also helped us, the Islamic Development Bank and the African Development Bank, as well as the European Union. So together, these funds are helping us to address both the economic response, the economic impact of COVID-19, as well as the health impact that we're experiencing in Sierra Leone. But again, I'd like to acknowledge the role of His Excellency the President, in the sense that last year, there was a special visit that he made to the President of the World Bank, advocating for additional resources. And it's good, we're happy that the resources provided by the World Bank arrived in Sierra Leone at this critical moment when it's most needed.
All right, Dr. Patricia, definitely all the best of luck as your country continues to grapple and deal with the impact of the COVID-19 pandemic. And I understand that things are going on smoothly. So, well, thank you so much for your time on Beyond Markets today. I've been speaking to Dr. Patricia Laverley. She's the Deputy Finance Minister of Sierra Leone. And that's it on Beyond Markets for today. And thank you so much for watching. Remember, you can catch the show at 5 p.m. West Africa time daily and have access to all episodes of Beyond Markets on our website. That's at cnbcafrica.com. From me and the team, enjoy the rest of your day.